transmission-based precautions and the proper PPE to put on for those precautions. So first, we'll talk about standard precautions, which is defined by the CDC as a minimum infection prevention control, regardless of the patient's status or whether they're infected or not. And this includes proper hand hygiene, use of PPE when indicated, equipment management such as sanitation techniques, and cough etiquette. So for hand hygiene, I'm sure you guys all know how to do this. You would wash your hands before and after every interaction. You would make sure to wash every surface of your hand with soap and water for at least 20 seconds. And for PPE, you would put on the appropriate PPE based on the clinical scenario. So for example, if you know you're gonna work with a patient who is gonna have bodily fluids squirting around everywhere, I guess. Put on the proper gown, gloves, face shields, things of that sort. And then you would properly manage your equipment as well afterwards and before. So if you're gonna use anything with the patient, make sure to use the proper like cleaning wipes to wash that afterwards so you don't infect anyone else when you leave the room. And you would implement respiratory or cough etiquette with the patient and yourself. So if anyone is experiencing a cough, you would encourage them to cover their mouth when they're coughing, and ideally that person would wear a surgical mask, be at least 3 feet away from everyone else, and encourage them to use the proper hand hygiene as well. All right, so now we're gonna talk about transmission-based precautions, which is in addition to standard precautions when working with patients, and it's defined as a second tier of infection control in the presence of diseases that are spread through airborne contact or droplet precautions, or droplet routes. So the first precaution we're gonna talk about are droplet precautions, which is used for patients who have a disease that is transmitted by respiratory droplets, including influenza, meningitis, pneumonia, all these diseases you guys learned about in acute care. And so with these patients, ideally they're gonna be in a room either by themselves or with people with similar precautions. And you would instruct this person whenever they want to leave the room to wear a surgical mask. And so when we put on PPE to work with these patients, you're first going to perform hand hygiene. You're gonna put a surgical mask on before you enter the room, and then you're gonna put your gloves on, which Kevin is going to demonstrate at the end of the presentation, or right now.
No, at the end.
At the end.
It's much easier.
And then when you're done working with this patient, you're gonna remove your gloves, perform the proper hand hygiene. And when you leave the room, you're gonna take off your mask and perform hand hygiene again, just in case you touch the front of the mask, which is an infected surface.
So now for airborne precautions. So for patients with small particle infections that travel through the air, including measles, TB, varicella, which is chickenpox, and then shingles as well. So you want the patient in a private negative airflow room with the door closed, and if they are to leave, they will also have to wear a surgical mask. So this one is very similar, just now you have the added piece of an N95 mask or a capper, which is fancy, but yeah, and an N95 will work just as well, and then gloves. So.
All right, so contact precautions, pretty self-explanatory. You get it through direct or indirect contact from a patient. Usually we see we use these precautions with MRSA, E. coli, Hep A, rotavirus, C. diff, etc. And you're just gonna have the patient in a private room. You wanna dedicate items like a stethoscope or a gait belt specifically for that patient, just so you're not using it on them and then passing C. diff over to Anthony or whoever. And then you also wanna disinfect the equipment with bleach, just to make sure that it's fully clean for that patient each time. And the PPE, this one is my least favorite. That's because you lose all pocket real estate. You're gonna be using a gown and gloves, and you wanna remove these before leaving the room and then immediately wash your hands upon exiting. COVID precautions, if you know what that is, airborne and contact. So we're gonna use the same precautions that I just described with the gown and gloves, and then you're also gonna use this guy right here, the N95 mask. And isolation is required, and the patient can't leave the room, as we all know. And then just a little asterisk, we didn't know if we were supposed to talk about it, so we just threw it in there as a bonus. The neutropenic precautions, you want to wear gown, gloves, and mask, and then no flowers, fruits, or vegetables should be brought into the room.
So yeah, very, very easy donning order. course, you got start with the gown. However, and big thing, have the back tied. I don't know. They taught us that. I don't know if you guys still do it. It makes it nice. So you just put it on. Get this on. And then you find this. Tie it. There you go. Wonderful. And then you put the face mask on. I'll use this one. I'm not putting it on the end anything. So face mask on. Try not to touch the front as well. You're gonna want, as I just touched the front, it's totally fine. And if you have goggles or a face shield, put those on. And then wash your hands. Put the gloves on last. And I don't need to put them on. But when you're taking the gown off as well, so you want to take the gloves off first, of course. And then you can also take the gown off with it. So it just comes off as one. So gloves, gown go off at the same time. Then the goggles after you have washed your hands. And then the face mask without touching the front as well. Okay? And then once you leave, wash your hands again.